We're going to measure your body composition, which the term body composition just refers to um, how much of your body mass is fat mass versus lean mass, like muscle and bones and lean tissues like that. So it's important because fat is necessary, but it's detrimental in excess, right? That excessive level of fat is associated with cardiovascular disease, stroke, um, diabetes, different cancers, and it also causes adverse psychological effects, right? Like negative body image and really ultimately a lower quality of life. And how we measure it, there's different ways to measure it, but how we're going to measure it is basically there's a tool. It's a specialized set of calipers, and we measure pinches of tissue on the surface of your body. We pinch off some tissue, and we measure it with the calipers, um, specifically the width of the skin fold. And there's 7 sites that we measure around the body. Um, and in the coming clips, I'm going to show you uh, how the pinch is performed and what sites specifically we're talking about using. All right, the following diagrams are going to be illustrations of where the 7 locations are that we're going to measure the skin folds, and also it'll even show you specifically how the fold is created, so the direction of the fold, and then that means that I would also be showing you where the 2 points of pinch are coming from. Now remember, at each of these sites, we're going to be doing 2 measurements, and if the 2 measurements are not within 1 to 2 millimeters, we're taking a 3rd measurement. So here's the first one. Okay, there's a blue pin line that looks similar to this black line over here. This blue pin line is marking the anterior iliac crest, right, which is the most prominent bony structure that you can feel on your hip. I'm feeling it on myself right now. Okay, and then just about 2 centimeters above that, you see a red X. Okay, that red X is the side of the pinch, and then if you see the 2 red arrows, that's the direction. I'm sorry, I misspoke. The red line is the line of the skin fold, and the 2 arrows are where the points of pinch are coming from. So they're coming from kind of the northeast direction and the southwest direction. That's to create a diagonal skin fold there. So we call that the suprailiac site. All of these are going to be measured on the right side of the body. And like I said, 2 trials at each site. You hold the skin fold for 1 to 2 seconds, no longer than 1 to 2 seconds, before reading with the caliper. All right, this is supposed to be a diagram of somebody's right leg. So in this region, we have the kneecap. This is supposed to be somebody's shin and calf, and then obviously their toes. So from your waist joint or your inguinal, crease to the top of your kneecap. So we find the midline, the midpoint of that distance, and then the middle, left and right speaking, which gives us this red X. So again, the pinch is coming from a left side and a right side, creating a vertical fold. So that dotted line was representative of the vertical fold, and then the pinches are coming from left and right to create that vertical fold. So this is in the middle of the thigh, both height-wise and horizontally. All right, here is the chest fold. So if you can imagine somebody's front armpit crease, on the front side of their body, we take their armpit crease and we measure to their nipple. This is the procedure for men. It's a different procedure for finding the spot in women, but for men, it's from the front line of the armpit crease to the nipple, and you divide that distance in half, and it oftentimes results in a diagonal line. So again, we have a pinch coming from northeast and kind of southwest, so as to create that diagonal skin fold. All right, another self-drawn diagram. Bear with me. This is supposed to be a side view of an individual from their left side. So if you can see, this is the line of their back. This is the line of their chest. and then they have their um, left arm pulled across their body, sort of like this. So this region is what I've attempted to draw here. And you got their armpit, and so basically it's on the side of their body, directly in the middle of their torso, their mid-axillary line here, and it's at the height or the horizontal level of their xiphoid process, which we know is just the lowest pointy part of your sternum. So you follow that over horizontally until you're in line with the mid-axillary line, and that again is going to be a vertical fold. So the line of the skin fold is vertical, means that the pinch direction is coming from left and right. All right, this one's pretty simple. It's triceps, which is on the back of your arm from your acromion process, which is just one of your uppermost bony structures in the shoulder, to basically the top of your elbow, your bony elbow structure. You find the midpoint, vertically speaking, and the midpoint of that back arm, horizontally speaking. Again, it's another vertical skin fold with pinch direction coming from left and right direction. This one is very simple. 2 centimeters to the right of the umbilicus or the belly button, just 2 centimeters to the right. Again, we got a vertical skin fold, which means the pinch direction is coming from the left and the right. That would happen on the right side of the belly button. All these are on the right side of the body. And then finally we got the subscapular. This is a diagonal skin fold. Basically it's 1 to 2 centimeters below in medial of the inferior angle. So I outlined the inferior angle of the shoulder in red. 1 to 2 centimeters lower and more medial. So that's where I got this X. And it's a diagonal skin fold again. So the pinch direction would be coming from, I don't know if this is a left or a right shoulder here diagnosed, but it's going to be coming in. The pinch direction is always coming perpendicular from 2 directions to the line of the skin fold.